What do you know about acupuncture? Do you trust it? We'll be telling you all you need to know about it from Dr. Tracy Ann Brown. I'm Amita Prasad-Webb and this is The Good Life.
Oriental medicine practitioner is a practitioner of Oriental medicine, or Chinese medicine as it's also called, that practices acupuncture and Chinese herbal medicine. The practice of Chinese medicine is several thousand years old, about 3,000 years old, and it's used to treat a number of different conditions. Pain most popularly, but also for fertility problems, gastrointestinal issues, respiratory problems, person having difficulty with headaches, stress management. It's just a very large list, a long list of issues that persons come to seek treatment for. So acupuncture is the insertion of very thin needles, and I'm going to stress the thin, very thin needles into acupuncture points on the body. The needles are very thin. Most people don't feel anything when the needles are going in, and they're close to 1,000 acupuncture points on the body. Now, just to take you through it a little bit, each of the acupuncture points are grouped into what we call meridians. So you have the lung meridian, you have the stomach meridian, the spleen meridian, kidney, bladder, and so on. Each of these meridians have the acupuncture points that are along their pathway or meridian, and they have functions that assist with the management of conditions along these systems. So for example, somebody who's coming in with constipation or diarrhea or some kind of gastrointestinal issue, you would choose points along the stomach meridian or on the small intestine meridian, depending on what's appropriate. You choose points along these meridians to address the issue. In Chinese medicine, a certain amount of differential diagnosis is done to allow you to decide which acupuncture points are appropriate. In other words, it's not every acupuncture point on the stomach meridian that addresses stomach issues. You choose your points depending on what's going on. Is the person complaining of constipation or diarrhea? Are they complaining of abdominal discomfort? Are they having out of flatulence, out of gas, nausea, vomiting? The distinction, for example, between nausea and flatulence is that when you're having nausea, we talk about rebellious chi moving up. You know, nausea, vomiting, things are moving up. And when you're having a lot of flatulence, things are moving down. Rebellious chi moving in the wrong direction, which is down. So depending on what is going on and what is presenting, we choose our acupuncture points. Typically, most people know about the needles that a medical doctor would use, which usually has a hollowed out section in the middle to allow for the insertion or removal of liquid or fluid. We don't have that in the acupuncture. Nothing is being injected into the body, so the needles are really, really thin. So what happens is that the needles are tapped in very quickly, gently. Most people fall asleep while they're in. Most people are very comfortable. Most people are surprised at how little they feel. What happens is that you insert the needles, they're stimulated. You can stimulate it by a number of different methods. You can apply electrical stimulation to the acupuncture needles to help to reinforce or have a more vigorous acupuncture treatment. But in most cases, you don't need to apply electrical stimulation. You just insert needles and you do a certain manipulation with your hands, just to, so to speak, kickstart the acupuncture point to get the juices flowing, so to speak. But more properly, we talk about get the chi moving in Chinese medicine. 1 or 2 points may sting. Where? Points on your hands, points on your feet, points on your ear. And you can imagine, because you see your hands are more sensitive, your feet are more sensitive, your ears are more sensitive than perhaps the more fleshy areas of your body. So most people generally are comfortable, as I've mentioned, but points on the hands and the feet might sting a little bit more. But most people liken it to a mosquito bite. And even though some mosquito bites can sting quite a bit, it's not even as much as a mosquito bite. It's relatively safe. The concerns you'd have, and these, of course, are not something you'd be concerned about if you're going to a trained and licensed practitioner. So for example, if a person was using a not so clean needle, but then all acupuncturists use sterile needles. So that's not a concern you should have with in terms of getting infection from the needles that are being used. For example, when you're needling on the chest, there's a concern because you have the lungs right there. So of course you don't needle perpendicularly, you needle obliquely. And that in that way, you're able to eliminate the risk of puncturing the lungs, for example. So even if you're not coming in because you're feeling stressed, most people report that they feel very relaxed during the treatment. So if you're coming in for pain, some persons will notice that by the end of the acupuncture session, they feel some improvement in their pain. I don't always tell people to expect that, because in our cases, you don't have that scenario presenting. But many persons report that once they come off the table, they're feeling improvement in the pain. Most cases, within 24 hours, they're feeling an improvement in the pain. Now, if you're a person who's suffering with chronic arthritis or some kind of degenerative bone disease, you know, treatment is more matter of management of the condition, and you're not necessarily going to be skipping and jumping the next day. Right. But usually within 24 hours, you're going, okay, not so bad, feeling a little better. And then of course, with consistent treatment, things usually improve. It's important to get a full idea of the history. Usually the first visit is about an hour and a half. Subsequent visits are 45 minutes, because we've already done all the intake to find out what surgeries you have done, what other issues you have. And just bear in mind, you know, if a person comes in and says, I'm having low energy, I'm not going to ask you, when do you notice your energy is low? You're going to have to just make sure to check on what's going on with their heart. If they're having palpitations, are they having shortness of breath? Are they having issues with their bowels? For women, you might ask about the menstrual history. And there are certain standard questions you're going to ask every patient just to make sure what is going on. Because what is important to note as well is that Chinese medicine attempts or seeks to address the whole person. It's never just a matter of treating this one issue. It's never just an issue of treating just the pain or just, you know, the elbow pain or the belly ache or something like that. You want to look at the whole picture. And you may have a person coming in, for example, with insomnia, and we don't necessarily give a diagnosis of insomnia. It may be there may be different types of diagnosis in Chinese medicine that includes insomnia. Right. So we have to do that kind of differentiation, and having done a kind of, you can do a kind of differentiation by asking a number of different questions, because how we associate and group symptoms are a little different from in conventional medicine. You see the results after the first session usually. Sometimes it takes a second session. If we're dealing with pain, and in most cases, I recommend persons come in once a week, depending on what we're doing. So if you're having a lot of pain, very debilitating pain, I would recommend coming in twice a week. If we're doing certain kind of fertility protocols, twice a week. So some treatments require you come in twice a week, some treatments require you come in once a week. And then when we get to the point where things are very well managed, but because we know we're dealing with a chronic issue, which requires just long-term management, then we look at a maintenance treatment schedule. So now, if you came into me with lots of pain in your knees, and we get to the point where we go, okay, you're moving around, you're not having any swelling, you're generally fine, but we know it can flare up at any point. You might say, okay, come in for acupuncture once a month. Yeah. You may still be on some herbs, because herbs is an important aspect of the treatment as well in some cases. Okay. In some treatments, acupuncture is more appropriate. In some cases, herbal formulas are more appropriate. And in some cases, you do both together. Acupuncture points have been, there are certain acupuncture points, for example, yin tang, shenmen, which are, you know, you put them in and most people are like, yes, I reached my Zen moment, I'm feeling very relaxed and I'm feeling wonderful and joyful. And then you try to figure out, okay, so how does it work? Why does this acupuncture point cause you to feel relaxed and stressed? And to be honest with you, the full mechanism of how it works is largely unknown. But what is known is that when these points are needed, the persons feel less anxious, more relaxed. It also helps with insomnia. The acupuncture points have a high electric charge at the acupuncture point. You know, the human body has a charge, generally speaking. Right. And the acupuncture points have a slightly higher charge. So when you insert a needle, which is a metal, it's a conductor, it stimulates the point. We know these things. In terms of why this point then connects to this, or this point affects that, some of it is unknown, still being researched, but it does have this effect. On the note of stress management, the truth is, as much as I would put in acupuncture needles to help you to feel calmer and give you herbs to help you to feel calmer, if the stressor is still in your life, then, yeah, you know, but you know, on my end, I can do as much as I can and you'll feel much better. Most people, even people coming in for pain issues, report that they feel much more relaxed after the acupuncture session.
We are taking a break, and when we return, Dr. Brown will tell us the importance of Qi. Do you know what it is? You'll find out when The Good Life returns.